This conference will now be recorded.
Hello. Hello everyone. This is Dr. Aisha from Ariz. We are going to talk about MRCPI OB. Actually, we gave presentation before, but still students, they keep asking different questions because they have certain confusions. So let's go over them. Right now, I have this handbook of RCPI. It is telling about the regulations and information for the candidates. And it was published in 2016. So far, they have not updated it, but this year they are going to update all of this information. So this is a specialization examination. You can take MRCPI-1, which is offered in different disciplines, and after that, basically the MRCPI Part 1, it is the same for all disciplines, and then you can choose your own specialty and you have to go for the specific Part 2 exam. So right now I'm going to give you a demo on MRCPI Part 2 OB/GYN. So what are the entry requirements? So let's go over them. So the candidates, they are eligible to enter for the Part 2 written examination, which will lead to membership when they have succeeded in MRCPI Part 1 or they have obtained exemption from this requirement. Like they have MRCOG 1 or they have some other qualification which is equal to MRCPI Part 1. Certain boards are recognized. So, but it is convenient, it is better if you do MRCOG 1 and then you can go for Part 2, but you need to have 2 years requirements. Then there are certain other posts which are recognized by RCPI and IMC, and like you should have done 2 years job in OB/GYN, like 1 year should be in OB, 1 year should be in gynae, or there should be 2 years in combined jobs. And each post should be held for at least 6 months and it should be recognized. Like you can work as a junior house officer, that will be considered. And if you did Part 1 before 2019, then you know that college will RCOG is asking you to go directly for the Part 2 examination, but for RCPI still you have to cover 2 years. You need to train for 2 years and then you are eligible to take the exam. So even if you are working in OB/GYN in your own home country, this is recognized. You don't have to worry about that. It's not essential that you should do that in the Irish system. But if you are doing in the Irish system, then you have very specific systems, and like you are in the talent pool, you are following one scheme or another one, and depends that in which facility you are working. So the things, they will become easier for you. But still, even if you are working in your own country, you are eligible to take Part 2. Now the problem with the Part 2 examination is that the college says that you can take 6 attempts, but the problem is that it's very hard to find a place, and you must have noticed some recent changes. Like initially, you were just required to make an account on the college website, upload your documents, upload testimonial, which should have been signed by 2 doctors. Not necessary that they should be consultant or they should be working in the RE system. They should be just registered practitioners, can be your registrar, can be your consultant, can be your fellow physician, but they should be registered with some authorities like PMC, IMC, or IMC of this India, or GMC. Anyone can do that for you. And then you have to upload, and then you need to give them some time. And once they have screened you, then they will let you know that you are fine and we can go ahead. And then you will have to submit your fees. The problem is that this exam is very costly, time consuming, and now it's becoming harder to find a place on the examination. And so do your best to pass in the first attempt. And how much time you can take before you need to take OSCE? the maximum time period is 7 years in which you have to complete all exams. So you have 6 attempts at written exam and you have 4 exams on 4 attempts for OSCE. Again, it's very hard to find a place on OSCE. They have made several changes, but since I'm not talking about the OSCE people, so I will just let you know about it, about the written examination. Like either you have, so we can summarize it like this, that either you should have MRCPI Part 1 qualification, or you should have some equal qualification like you should have MRCOG 1. And then you will go for MRCPI Part 2 written examination. Luckily, when you pass, then you will proceed and you will take this OB/GYN, OSCE or clinical examination. God forbid if somebody fails, then they can resit the exam. And the second time, once someone has passed this OSCE exam, then they can go and they can get this MRCPI degree. It would be conferred and then you can register yourself with IMC. And if you are coming from some other country, then for the initial 6 months, you will have to work as SHO. And then once you are confident, you are familiar with the system, then you can always ask for reassessment and they can promote you. Most of the candidates I have come across, they will usually request a review within 2 months and then they can proceed and they can be registered as specialists. So they specialize, their category can be changed. If someone has failed again, then they will have to go back and they will have to take the written examination, and then after passing that, they will proceed and they will go for the OSCE. There are certain exemptions, like the MRCG Part 1, actually it should be done. In the past, some qualifications were recognized and then the people were exempted from MRCG 1, but that privilege is no longer available. Like many people, they used to do this FCPS 1 and then proceed with the second part, but now this is not recognized like that. Someone who has completed some degree from MRACOG from Australia or MRNZCOG, this is equivalent of MRCOG from New Zealand, or FCOG, which is from South Africa, or FCPS, both parts, Part 1, Part 2 and OSCE, then they can go and they will not be exempted from the Part 2, so they still have to take it. Then you should know that this is combined degree from which is recognized in both Australia and New Zealand, and then this MD of the Malaysia in the OB/GYN. So it depends that what are your circumstances. So that's why you will upload everything on the college website, and then they will let you know that can you go for the written part or you have to fulfill some other requirements. So there are centers in the Ireland, like previously they've made center in usually for the written exam the center is in Dublin, but for the OSCE they made center in Cork also, but they can change that also. And then there are certain worldwide centers which are peripheral centers, but to get this information you need to visit the college website for the updates. Now when you know the background, then the most important part of exam is that what you should read. Preparation for MRCPI examination. So you should know that exam is conducted in English language, and the college has produced many guidelines. Right now they are reviewing them, rather they have been doing it for the last 6 months. So many of the guidelines, they have been removed from their website and some have been updated and some were updated recently, so they are still on the web page. But for us, since we are member of the college, so we have access to all these guidelines and we have downloaded them, and we will keep updating you as we will get new information. Then I can see a lot of confusion in the candidates. Among the candidates, they think that MRCPI is an easy exam and the syllabus is very short. I'm sorry to say that this information is not correct. It is just like any other international examination, and you are required to know about all conditions which you can see as a gynecologist and obstetrician. The college has also given its guidelines, its modules, everything is there, and you need to cover all topics. there is misconception that no statistics in the MRCPI. No, that's not true. You are going to get like 5 questions on biostatistics. So in your exam, you are going to see 100 SPAs, and the college prefers to call them clinical winners. Why? Because they are going to give you a mixture of questions. Some are just going to test your factual knowledge. They will be like single best answer. I will give you some examples later, like SPS, where they will give you one information and then they will give you different options, and you will have to choose the most suitable option. In clinical winners, they are going to give you a short clinical scenario. It can be short or it can be like 2 pages long. So you will have to go over that and find the most relevant answer and then pick that one. Here the problem is that you will think about the ideal answer, but you know that ideal conditions, they almost never exist in the exam because they want to see your decision making. If the answer is very clear, then no benefit, because maybe you are just reproducing your factual knowledge. So here they will have to assess that can you apply your knowledge to different critical conditions or you cannot. That's why you have to practice with a variety of questions. So here also the college says that the candidates are expected to have a comprehensive knowledge of OB/GYN together with those aspects of other medical disciplines relevant to the practice of both. Like you should know what is a multidisciplinary team, when you should involve other specialties, and when you can just sit and do the things on your own. Okay. Then you should know that what are your limits, when are you going to stop, when are you going to call another one. So then you should know that you need to know about your basics. Like they don't expect you to do all genetics and biology, but they can always ask you that what are the normal and the abnormal karyotypes, inheritance of different genetic disorders, and genetic causes of infertility, early miscarriages. So you should know about them in general. Then you should know about the ethical dilemmas, how we can, you know, protect the individuals, how what you should do if there is one embryo which is result of ART, artificial assisted reproductive technology, and now the couple has split. So how are you going to proceed? What are the rights of surrogate? Who is going to consent? And many things they will come into play. Then you should know about anatomy, which is why, because the surgical anatomy, operative anatomy is very important. Then you should have basic concepts of pathology, biochemistry, endocrinology. These things are always tested. In your exam, you should expect to find like 15 questions on basic sciences. Pharmacology, you should have comprehensive knowledge of all aspects of pharmacology. And you should know that what drugs do we use in OB/GYN, why do we use them, what are their advantages, indications, what are the disadvantages, what are the side effects. You should know about the drug interactions. Then specifically you should know about the teratogenicity of these drugs. These things are very important because they are directly related to the patient safety. Then in which conditions you need to give 5 mg folic acid, because some of the drugs they can cause deficiency of folate, so the babies can develop neural tube defects. So you should know about them. This is very interesting area. Then you should know about the analgesia during labor, anesthesia, post-op analgesia. All of these things should be on your fingertips. You should know about the immunological disorders. Then you should know that how the immunity develops in the baby, and that you should know about the Rh incompatibility, other types of isoimmunization also. Infectious diseases are very important in both pregnant as well as non-pregnant ladies. And categorically, you should know about epidemiology, diagnostic techniques, prophylaxis, immunizations, antibiotics, antiviral agents. What are the effects? What are the chances of transmission of infection to the baby? What will happen to the baby? How you will proceed? Do you need to carry out diagnostic tests or what? So all of this information should be there. Then in the OB-GYN, you have to, in the obstetrics, you have to start right from history taking, examination, and then you should know about common obstetric procedures. Then you should know about normal pregnancy and puerperium. So it makes core knowledge of the interpartum care, and you should have knowledge of anesthesia and analgesia. So first of all, you should know the normal pregnancy so that then you can appreciate that what will be an abnormal pregnancy, abnormal labor, and puerperium. You should be able to diagnose and then manage them. The postpartum period is also very important. You have to provide clear assessment of the fetus, and you have to provide postpartum care of the woman also. Then pre and post pregnancy counseling, that is very important, especially if the mother is having some medical disorder or if she has some contraindications to some types of drugs. So you should be able to prescribe the most suitable form of contraception for the mother. I will tell you about the resources which you should be referring to after a while. Fetal-maternal medicine is very important. When you should stop, when you should suspect something, when you should refer a certain patient to the higher center, and what will happen, what are the expected fetal outcomes. All of this information is very important. Now let's talk about gynecology. Again, you are going to start from history taking, physical examination in gynae. You should have detailed knowledge of all basic gynecological procedures. And you should also have the knowledge of more complicated procedures. For example, in oncology and then in reproductive medicine. And they don't expect you to know about everything, but at level 1 and level 2, you should be knowing everything. Level 3 is for the tertiary care or subspecialty care. But you need to know about the pre-malignant disorders, malignant disorders, risk assessment, when you should stop and refer the patient to the higher center. And also the cervical screening program is here. And people, they think that the cervical screening program of the UK and Ireland is the same. This is totally wrong. You have to follow the Bethesda system. The procedures can be the same, but the classification and comprehension, how you're going to describe these classifications, this is different. Then you should know about prepubertal gynecology. What is the normal and abnormal sexual development, pediatric pathology, its management, normal puberty, and disorders. So you need to know about precocious puberty as well as delayed puberty. Disorders of menstruation and menopause, these are important because you need to determine the cause and then you need to address the specific issues of the patients, that they are seeking fertility or they are suffering from premature menopause. All of these things are covered here. Abnormal uterine bleeding, dysmenorrhea, menorrhagia, then polymenorrhea, menorrhagia, everything is covered here. Subfertility or infertility, you should know about the epidemiology. You should know that the incidence is rising. What are the causes, investigations, management of infertility, together with basic knowledge in the techniques involved in assisted human reproduction. Family planning is very important. You should know that what sort of contraception you are going to provide to the teenagers, to the middle-aged women, and the women at the break of menopause, when they're just transiting from one side to another one. Then you should know about postpartum contraception, emergency contraception, then contraception in special groups like the teenagers, then those people who have some medical disorders. So these things should be very clear. Psychosexual medicine, the knowledge of principles of the psychosexual medicine is required when the patient is having psychosomatic disorders. When they have some organic disorders, you should know about them. And so we need to talk about a variety of conditions here. Then gynecological oncology, you should know about the epidemiology and etiology of gynecological tumors, principles of carcinogenesis, tumor immunology, pathology, and you should know about the most suitable diagnostic techniques. And staging of the cancers, you are going to use the FIGO staging. Then you should know that what are the basic principles of treatment, and you should know about surgery, radio, and chemotherapy. And additionally, you should know about the care towards the end of life or palliative care. And when you have no hope that your patient is going to survive, then you need to provide them just supportive care. Then you should know about cervical cytology, colposcopy, and their triage, how you're going to do that, how you're going to offer all of this information. Regarding urogynecology, some of the candidates, they think that this is a subspecialty subject, so don't have to cover it. I understand that this is subspecialty subject, but still you need to know a lot about it. You should understand the basics. What is the how does a normal uh, urinary system works? Where are the central controls? How do we know them that we are having some problems? What is bladder diary? How are you going to evaluate your patient? What are important points in history? How are you going to counsel them? When you are going to refer them, when you will need just physiotherapy, when you need to carry out urodynamic studies, how do we interpret them? What are their limitations? And how you are going to take your patient from the conservative management to the more interventional procedures like that. So then in urogynecology, you should know about the pelvic organ prolapse, pelvic floor issues like fistulas, recurrent UTIs, and then some changes are taking place. So all of these things have to be covered. Then, like I said in the start, that people have a lot of confusion that they think that no statistics and no epidemiology. This is not correct. You need to know about the statistics and epidemiology. They are equally important. So, but especially which is relevant to your discipline of OB/GYN, like that. So then how you will enter to MRCPI Part 2 examination. Then you know that you will go to the college website. You are going to make your own account and you need to upload your papers. You need to upload a testimonial, like I've told you before, that it can be from your embassy, it can be from Irish or British consulate, or it can be from the Commission of Oaths, or if somebody has like this public notary power, they can also do that, or your own hospital, or your university or medical school, anybody can do that. So that and these are the points. They can sign that testimonial for you. So, and then these documents you need to upload. Assistant, like attested copies of your original degree, MRCG Part 1 pass letter, or if you have done MRCPI 1, you need to upload that one. Then testimonial signed by the 2 doctors who have been working for like 5 years, and that is the point, okay? And then you need, once they approve, then you have to upload you have to pay the fees, and then you have to wait for them. If you are planning to take exam in Ireland, then the college is not responsible for resolving visa issues. You have to arrange that well in advance. So my advice would be that go to a place where you can go easily. Like people, they like to go to Dubai. If you are in the India, then you can take it there. So if you have to arrange for visa, then you should do it on time. Usually this embassy, they will give you this visa within 3 weeks, 4 weeks, but still you have to think about it, because in case your visa is not approved, then college is not going to refund at all. Okay? So make a good plan. And if luckily you are inside Ireland, then you know that you don't have any problem. Even if you are in UK, then if you are a citizen, then maybe you will not require. But if you are just working there and your citizenship is not matured, again you need to take a visa for it. Examination fees, it keeps changing from time to time, and then you cannot withdraw. Like if you want, if you're not beyond and you have not crossed the deadline, then you will get some withdrawal, but this is college policy, so it keeps changing from time to time. Okay, like that. If you have been unable to attend exam on any part, then that will not be counted as an attempt. But if you have crossed the deadline, then no one is going to return your fees. So you have to choose a time when you can easily go and take the exam. Regarding the format of the exam, that you will be tested in both OB, obstetrics, and gynecology. And then questions will be relevant to your clinical practice, medical, then multiple choice questions, papers, OSCEs, and the clinical examination. Now they don't have essays. They have not updated this information. Actually, this all changed in 2017, March. So we are going to get 100 SPAs. Duration is 3 hours. This is a computer-based testing, and each question is equally weighted. So there is no negative marking. So you are strongly advised to give a considered response to every question. They will give you a rough sheet also. So don't worry, just go in a sequence, and you have to be vigilant. First, you have to enter your candidate number, which is different from your college number. Okay, or sometimes they will tell you that you have to enter that number of your exam. These things are different, so listen to the instructions carefully and do the needful. And then they will give you a rough page also. So if you are not happy about your answer, just write down on this paper that my answer is not, I'm not happy with my answer to question number so, and that's why I need to go and have a look again. So you have to be very careful. Once, even if by mistake you submit your answers, then you will not be allowed to continue the test. So you have to be very, very careful. And then you should write down your answers on the page, like page 1 to 100. There are just 100 questions. So write down in sequence that what is your answer. And if you are not happy about it, so in case you have not entered that, then you should know that which answer you have selected. Because some of the questions are going to be ultra simple, just like simple questions that patient is epileptic, so how much folic acid you are going to give her? 5 mg, this is a simple question. But other questions, they will not be like very simple. Then you will have to tell them other things, like they can be in 2 steps. That patient was taking some medicines, she is on an epileptic drugs, so what will happen to her? The baby is there, or things like that. So that's why you have to be very careful. Any questions so far? So that's why it is important for you to go in a sequence. Don't leave any questions, don't leave any blanks, write down your papers and your answers, and then in the end again check. Some of the questions will be ultra simple, some of them will be very long, so you will have to choose, and then you will have to act accordingly. So our team, we analyzed the questions for several years in several exams, and we came up with these numbers that mostly they will ask about 15 questions, they will be on management, about 18% are on investigations, 13% are on diagnosis, 5% are on natural history, 4%, but it can be like 4 to 15% on the basic sciences, general gynecology 12%, general obstetrics 18%, research, teaching and biostats 15%, which is a big number. Then subfertility, here you will get comparatively few questions, like can be three to 7 questions. Then oncology, almost 8% questions. Regarding Ariz courses, I will tell you. Then still RCPI, they are still repeating their recalls, like 30 to 35% questions, they will be from the previous exams. But again, the question is not going to be asked like it was asked last time. Topic will be the same, but the question will be framed in a different way. And 30 to 40% new questions will be there. So then my advice will be that you should just go over them, know your basic facts, and you should remember main points in the guidelines, algorithms, and the tables. And because you should do it like 3-4 times before the exam, basically you need to do the college recalls, and that you should be concerned about the topic, nothing else. Okay. So I told you about the other topics, but once you join our course, we have these lists, like we are just mapping out college guidelines. That what do we expect you to know? Like these are the sections. There are some general components, and then there is a specialty section in which they are going to ask you about everything in the obstetrics, and then they can ask you about anything in the gynecology. There is a full list, okay? And then again, you should know about the consent procedures, their legal implications, and then who should be on your team. If the patient has medical disorders, you can see that here they have given a list of medical disorders also. Then you should know about the maternity wards, how you are going to prioritize them, and how are you going to appoint someone to care for such patients. Okay? These things are important for you. So, any questions so far? Any question, any problem so far? You can always ask me. Okay. So I will tell you a bit about the Ariz MRCPI courses. There are different courses. Now this one, since many of you have asked about the courses now, because as you know, the previous exam was scheduled on 24th of March. Then it was postponed to 1st April, and then it was postponed to 30th June. And now again, it has been rescheduled, and 19th of September. We expect that exam will be on 19th September. So this was just a brief introduction and information on the course. We organized this book. I will take you towards the courses also, since it came in the way. That this course is going to start from June 15 and it will end on September 15. So, and we need to cover all RCPI guidelines, relevant green top guidelines, then NICE guidelines, then TOGs, BJOGs, and then important exam winners. Like we have like 1,000 plus winners, so we can always have mock exams, and then the past papers, and then we have the sport groups also, like that. Then there are like crash courses also, like they are just for 1 month. Like I will give you here is just one example. Now this information has been changed because, but you can see that we covered all the things and we covered all modules like that, which are given by the college people. So once you join our course, what we do is that we give you full plan for 3 months. If you're coming for 1 month, then we will give you one month plan. So here you can see that usually the classes are on Saturday, Friday, Saturday or Sunday. And initially we have like one class a week, but near exam, like in like a month before exam, we give you 2 or sometimes 3 lectures a week. Why? Because basically we are revising and we want everyone to participate in them, and they should take exam with full confidence. Then on the weekends, we are organizing tests which are topic based. So for some, if the module doesn't have many guidelines, not a lot of material, then we will test you after 4 days. But if the module is very lengthy, then we will have to wait for some time and then we will take the test. So whenever you register with us, we will give you this booklet, and then we will take your we will track your progress like that. That is the point. Okay? So regarding this MRCPI OB Part 2 online course, this is by Ariz Exams. Initially, we have been teaching people through Skype, and at that time it was done by some consultants who were based in Dublin. Like some of them were in Rotunda Hospital, some of them were in the National Hospital. So some of them were in Limerick, some were in Cork, so they were from different places. So just to organize the study, they were taking students on Skype like that. But gradually, as they moved, some of the teachers they moved to UK, some they stayed in the Ireland, some of them are still there. So then we came up with the idea of online courses. And I will tell you that we get many students, and basically we get students from Ireland and then from India, Pakistan, and from Gulf. Yeah. So why these Aries exams? Because we are offering courses in for many exams. and these are online. You can attend from your home, you can attend from any device, and you will have your specific password, and you can approach any tutorial anytime you like, and no restriction that how many times you will go and you will listen to that video. Then all of us, we have got our certificates from UK, and like the degrees from the UK and also from the Ireland, and some of us have worked in the US also, so we have degrees from there also. So if the students they demand when they join the course, we show them our degrees also. So once you start our course, then you should know that what you will get in a on your web page. So basically you will get your online video lectures which are live, and on the same day they are uploaded. You can see here, if I can magnify that one for you. Let's have a look at this one. Like you can see that this is the page for MRCPI. Okay. So here are like two lectures are here, two videos are here. Then for the same lecture, you are going to get the PDFs, and our courses are different for MRCPI and MRCOG because there are overlaps in certain areas, but some of the guidelines and the stuff they are totally different. So we have to consider everything. So once you have finished one tutorial, then you have to go and you have to take the online test. You will have to enter your email. This is required. Without that, you cannot go anywhere. So maybe I can show you some example here also. So this is just one example. This is from the directly from the web page. You will go there, you will look at the question, you will, let's say that you want to select this answer. Here is written that you will get 1 point for it. So similarly, the number of the quizzes is going to differ in each test. So, and like you have seen that this is the test one, so there are multiple tests. These tests, they have their specific IDs, and they have, like you can see that this is a short question, and then you will get some clinical information. Some of it, some will be even longer, and sometimes the questions are very lengthy. I mean, you are going to get a combination. Okay? And these questions are written by experts, and they are given in a module-wise fashion. And then once you start our course, we take the baseline test. Like you have to do our questions, and then we will go and then we will go for the mock exams pre-test, then you will do the quizzes, and then in the end you have to do certain mock exams. The pre-test, this is just to see that what is your baseline level, because everyone is not going to do the same things. Your mentors, they will see that where are the deficiencies, where are the shortcomings, and then they will guide you accordingly. Then you can see that this is a biostats test, and then basically they have a Q bank which has like more than 1000 SPAs for you. That is the point. Okay. And then after the pre-test, you are going to see the PDFs, and then you are going to see the recordings also, like that. So this is like some information on the biostat, like that. So every part is written properly, and then it is given to you. Then for the MRCPI also, we have QBank, where you should get 400 plus minutes and then 800 plus SPAs. And here we have tried to give you exam like scenarios, and these are not like other colleges, or these are not like the common SPA books that you must have seen in the market. Okay, then what material do we use? Basically our CPI OB guidelines, then some green top guidelines and nice guidelines, because there is, you can say that there is sort of agreement between the RCOG and RCPI, and there is a whole list of topics which are shared between these colleges. The information is shared. One good example would be that of Embrace. Okay, maternal mortality report. Then you're supposed to do at least 2 journals, like the obstetrician, the talks, or the obstetricians and the gynecologists, and then some information from the BJOG. Good practice guidelines, some scientific impact papers, consent guidelines are very important. You need to cover some scientific impact papers, patient information leaflets, OGRM. You know that this is also a good journal, European journal. So sometimes the good studies are published here, so we keep an eye on that and we try to give such information to our students. Then they write that evidence-based medicine. The college doesn't want you to stick to some specific book. They have, but it should be evidence-based medicine. Okay. Then you should know a lot about the FSRH, their guidelines. We will go into details. Then you should know about the batch guidelines. So all of these things are important. Then regarding the exams and the packages, there are different packages. Some people, they will come to us and they are taking their first attempt, and some of them, they will come and they will join the 1 year course. Trust me, right now we have many students who started preparing with us in October, and you see that October, when was October? Like 8 months ago. So you can imagine that how well prepared they are. So this is 6 month long course. We offer that. It's a comprehensive course. You will get weekly classes and more frequent classes near the exam. Then these classes are highly interactive, and then you will have access to recorded sessions till the next day of your exam. So module-wise teaching is done, pre-test, quizzes, and mock exams are there. So you're going to get the Q bank, and usually, you know, this Q bank is offered at $100 per month. So you can see that in this package, we are giving it free of cost, and then we are giving 4-week crash course also, and 2 mock exams are also included. The second course is 3 to 4 months regular course, and this one is not this time, it is for 3 months, and again comprehensive course, weekly classes. In the last month we are going to have, maybe we will have like 2 or 3 times classes a week, or maybe daily classes, depends that how your group will be performing, and then we will have to give you the sessions accordingly. Again, module wise teaching, pre-test, access to QBank, everything is there. Then a crash course of 4 weeks. Here, no one is going to explain things in detail to you, but you will be accessing the recorded lectures. And your mentor will be tracking your progress. And if you need their input, then they will come and they will help you. Our 3-day revision courses are very popular. These are basically designed for the doctors who have already taken the exam like 2 or 3 times, and they are failing at the margin. So we develop these courses to help such doctors. Here we will do just case-based learning, like we have 2 short courses, and we discuss the strategies to answer the exam questions, then how to improve the score, and more importantly, what they should not be reading. So in this course, we offer 8 hours daily sessions, and this is a sort of rapid revision of the key topics. And these people, they will get 10-day access to the QBank. And the costs you can see here, or when this recording is available, you can go back and you can have a look at them. Then the QBank, you can take it separately, like you don't want to join any course, but you just want to practice with the different questions, then you can take it. So here you should know that here you are going to get exam like questions. And this QBank, it's specific for MRCPI. It is not like other courses where the same question pool is given for EBOG, Saudi courses, Arab board courses, or for the RCOG. This is specifically for RCPN. You can have multiple attempts, you will get instant results, and then at the same time you will get a comparison with others also, that how many people they answered that question correctly, where do you stand, and how much you need to improve. So these questions, they will improve your critical thinking and reasoning skill. Again, you will get like 400 plus clinical winners and 800 plus SPAs, and the cost is $100 per month. You can renew it monthly, or you can take it in a bulk, like for 3 months. Usually students, they take it for 3 months because they keep practicing. So here I'm just going to show you some testimonials. People, they go to other courses and then they come back to us for further revision, and then they stay with us for the OSCEs also. So here is a list of some candidates who came to us last year, and they took exam like in, I will say that they took exam in last year, in the first part of it, in August, and then those who took the exam in March, and then in August. So we had very good, excellent results, like 95% of our students, they passed in the first attempt. So if you like to book any courses, you can just drop an email here. Here is the address, and you can find it on our web pages also. And here is the WhatsApp number. Like, so you can see it from here, or you can just find it there. So thank you very much for attending this session. So if you have any question, I'll be very happy to answer that to you. Is there any question, any problem? Okay. If nothing, then I will just give you a brief sample lecture. This is based on the RCPI guidelines, and this is on management of pelvic girdle pain in pregnancy and postpartum. So PGP, this is a specific form of low back pain defined as pain experienced between the posterior iliac crest and the gluteal folds, particularly in the vicinity of the sacroiliac joints. 25% of pregnant women and 5% after birth, they seek medical help due to lumbosacral lumbopelvic problems. And the point prevalence of pregnant women suffering from PGP is about 20%. Clinically persistent PGP from the postpartum stage to 2 years after childbirth, it has a reported incidence of 5% to 8.5%. Ecology. Symptoms of PGP, they can begin as early as the first trimester at any stage during the pregnancy, in labor, or in the postpartum period. And possible causal factors include hormones, biomechanics, trauma, metabolic factors, inadequate motor control, and stress of ligament structures. What are the risk factors? Evidence for risk factors is contradictory and inconclusive. History of previous low back or PGP, and then history of pelvic trauma. Presentation. The onset of PGP can be sudden or insidious. Symptoms peak between 24 to 36 weeks of gestation, often mild but occasionally can be seriously disabling. Pain is usually located posteriorly at the sacroiliac joint and gluteal region and can be anteriorly at the symphysis pubis. How do we diagnose it? Clinical history, pain mapping, and after initial assessment, um, you can make up some idea. X-rays, CT, they are not recommended. Then diagnostic injection, gastric external pelvic fixations, these things are not recommended. Okay, diagnostic external pelvic fixation, these are not recommended. So MRI may be used to exclude ankylosing spondylitis and in the presence of red flag symptoms. What is the differential diagnosis of PGP? A diagnosis of PGP should be considered after the exclusion of the following pathologies, like bone or the soft tissue infections, which can be typical or atypical, such as TB or syphilitic lesions of the pelvis. UTIs exclude femoral vein thrombosis. Obstetric complications like preterm labor, abruption, round ligament pain, chorioamnionitis, and the bones or soft tissue tumors, cauda equina syndrome, then lumbar disc lesion or prolapse. Assessment of PGP, it should be done by the multidisciplinary team, which means that the GP, obstetrician and midwife, physiotherapist, occupational therapist, anesthetist, pubic health nurse, psychologist, and other allied health professionals are necessary. Treatment and management of the pelvic girdle pain antenatally and postnatally, it should be provided by a chartered physiotherapist. So in clinical history, these points should be mentioned. The parity, previous modes of delivery, previous low back or the pelvic girdle pain, previous pelvic trauma, and then aggravating movements and tasks, particularly pain and aggravated disability with standing, walking, and or sitting, activities of daily living, employment, workload, and the leisure pursuits. The woman's pain coping strategies. Then avoidant behavior catastrophizing due to the fear of movement and the present and past history of anxiety and depression. Urinary incontinence or sexual dysfunction disorders. There is no gold standard test for the diagnosis of PGP, but pain provocation tests, they have higher reliability and specificity than palpatory tests. So what functional pelvic clinical tests you can do? You can do active straight leg gaze test. You don't have to remember their details, angulations or stuff. Then sacroiliac joint pain clinical tests, like you can test the symphysis pubis. Palpation of the symphysis pubis, it may reveal anteroposterior or supra-inferior displacement of the upper border of the pubic symphysis or pubic tubercle. Then palpation of the long dorsal sacroiliac ligament. This structure is commonly tended to palpation in patients with pelvic pain. Then pain-free range of hip abduction and flexion, it should also be recorded. This is very important because once your patient is in active labor, you don't have to flex or abduct beyond these documented findings. Management in pregnancy. The aim of the treatment of PGP in pregnancy is to relieve pain, improve functional ability, and prevent recurrence and chronicity. Pain control is the most important aspect of management. So we have to start with the paracetamol and codeine-based preparations, and NSAIDs, they should only be used after delivery. NSAIDs, they should only be used after delivery. Evidence suggests that acupuncture seems to alleviate the low back pain and the pelvic girdle pain during pregnancy. Massage may be a useful treatment if used with an individualized physiotherapy program. Crutches should be given to the patients who have abnormal gait pattern and or pain on mobilizing and wearing weight bearing. Management in pelvic girdle pain during labor and delivery. What should you do in labor? Women with PGP involving bilateral posterior pelvic pain and symphysis dysfunction usually have a greater disability than women with unilateral posterior pelvic pain and symphysis dysfunction. Prophylactic low molecular weight heparin, it should be considered if restricted mobility. Disability measurements, they are recommended for delivery. So women with high disability scores in their obstetric chart, it should be mentioned. Range of movement of the lumbar spine, if necessary, it should be mentioned. Then pain-free range of hip abduction in sitting, supine, and lying position. Pain-free range of hip flexion in sitting, supine, and side lying. Then position of comfort, bed mobility, and gait pattern, they should also be recorded. What are the recommended positions of labor for patients having pelvic girdle pain or low back pain? Women who utilize upright positions during labor, they have a shorter duration of the first and second stage of labor, experience less intervention, they report less severe pain. During labor and delivery, any simple procedure which alleviates pain without danger to the mother or the baby, such as shifting from a horizontal plane to a vertical position or a more upright posture, they should be promoted and employed. Basically, you have to see that your patient is always comfortable. Induction of labor, if it is indicated for other reasons, for reasons other than PGP, then induction of labor is occasionally offered to those who are in extreme pain or who were who have severely limited in their activities. However, the risks for induction, they often outweigh the benefits, because as you know, induction of labor is a commitment, and if it fails, then you cannot stop, then you will have to give them another round of induction of labor, or you will have to go for abdominal delivery or cesarean delivery, so you are going to increase maternal morbidity. Assisted vaginal delivery. So ventouse is preferred and may be possible in a left lateral position. If placing the patient in the thoracic position, it should only be for a minimum duration of time. When using the lithotomy position for instrumental delivery or suturing, care should be taken to lift both legs passively and simultaneously into and out of the position keeping within the pain-free range. Epidural analgesia. So care should be taken not to exceed the pain-free range of hip abduction and flexion if epidural or spinal anesthesia is used. If a woman has chosen to use epidural analgesia, she should be encouraged to make small adjustments to her position during labor. What is the role of elective cesarean section? No evidence that a CS is beneficial for women with PGP or confers any benefit to recovery, prognosis, or recurrence of PGP. What is the management in the postpartum period? Women with pelvic girdle pain, they have greater needs and they often have longer hospital stays. Thromboembolism is a risk of immobilization, and in selected women with added risk factors, you will have to give regular analgesia, TED stockings, heparin, gradual mobilization, individualized physiotherapy treatment. It should also be started early. In the early postpartum phase, if the patient has moderate to severe pain, and they should be given adequate pain relief. So first choice should be paracetamol, and then second choice should be NSAIDs. Consider pelvic X-ray and orthopedic referral if the woman remains in severe pain. Breastfeeding will not slow the rate of recovery from the pelvic girdle pain because it has no effect. In the later postpartum phase after discharge, if symptoms persist postpartum, outpatient physiotherapy should be resumed if the woman is able to attend. If pain persists despite a period of rehabilitation, an orthopedic review should be sought. What is the prognosis? Pelvic girdle pain is mostly a self-limiting condition in which symptoms settle in the majority of women within the first 3 months of delivery. By the first year after delivery, only 1 to 2% of women they report the persistence of the pain. What can happen to the patient in her subsequent pregnancies? You need to inform the patient that there is a high risk of recurrence during subsequent pregnancies, but if treated early and well managed, it may not be as severe as she has experienced in this pregnancy. So that's all you need to know about pelvic girdle pain. Any question about it? If you have any questions, please ask me.